and welcome to this video. My name's Kris, I'm an Australian GP, and today I'm changing tacks a little bit. So if you've seen videos on my channel before, you'll know that I love women's health. I love talking all things periods and pregnancy and women's health. However, I think it's really important, especially as a GP who caters to everyone, to talk about problems that typically affect men or those born in male bodies also. So not only are we going to be tackling one of those problems today, but I also want to point out I'm wearing my glasses because, spoiler alert, I usually have my notes on my computer here and I'm so sick of going, talk. What? And it takes so much time to edit out those bits. So we're going to see how we go. I don't usually wear it because one, I'm not used to how I look in glasses in videos, and two, the ring light situation. I do that so my face looks a bit brighter because I've got such a bright window. Anyway, I'm rambling. All I'm saying is, yeah, glasses. It's all good. But yeah, the topic of today's video is erectile dysfunction, a condition that solely impacts those born in a male body. So what exactly is erectile dysfunction? So erectile dysfunction is when a post-pubescent person in a male body, a guy, a man, whoever, whatever you would like to say, is unable to either obtain or sustain an erection, usually until orgasm or satisfactory sexual experience, because orgasms aren't everything. Sometimes the inability to maintain or even obtain an erection to begin with can be associated with other sexual difficulties. So, what causes it? Well, a staggering 80%, that's 80%, of people who suffer with erectile dysfunction have a known organic cause. That is, their erectile dysfunction is secondary to another condition. Most commonly, something in the cardiovascular system. Cardiovascular system problems can include obesity or being overweight or obese, being a smoker, having high cholesterol, having high blood pressure, or having sleep apnea. So it's all intricately linked to the body. Other organic causes of erectile dysfunction also include type 2 diabetes, thyroid disorders, and androgen deficiencies. That is usually lower testosterone. It's also really important to note that there are some medications, some antidepressants, some heart medications like beta blockers, that can also make it harder to obtain or sustain an erection. Of note, I've already mentioned smoking, but other recreational use of medications and or drugs, if you want to call them that, including, like I said, smoking, alcohol, marijuana use, and IV drug use can also cause erectile dysfunction. Abusing steroids can also cause erectile dysfunction. So there's a lot of problems here with using drugs that aren't prescribed to you. And unfortunately, yes, smoking, alcohol, and even caffeine are all drugs. Now that's 80%, so that's the vast majority. 20% of people with erectile dysfunction have what we know as a psychogenic cause of erectile dysfunction. That is, it's sometimes more mind over matter. Usually, psychogenic erectile dysfunction is more difficulty obtaining as opposed to maintaining an erection. So, difficulties at the very beginning. This can be stress, this can be being distracted, this can be being, too much in your head, which I guess is stress, but I mean in the scenario itself, not in general. So there's a lot of things that can really affect an erection. So what do we do about it as GPs when you come to us and you say, I've got a problem with my erections? Although, to be honest, a lot of guys don't open that way. It's usually, I've got a problem with my fella. This is really embarrassing, doc. It is part of the human experience. It is it's part of having a penis. It's part of having that anatomy. So even if your GP is female, doesn't matter if we're female, male, non-binary, we are all taught how to investigate and manage erectile dysfunction and how to treat you with respect. And if you feel like you haven't been treated with respect, then I'm really sorry. That's not how we should act. So now that you are there and you're telling us that you've got problems, the first thing we're going to have to do is take a really thorough history from you. It's not just, I can't get it up, doc, or whatever. That's not enough for us to investigate. We will start asking you questions about puberty, about hair, as in, are you losing hair, gaining hair? Can you grow a beard? Are you not able to now? Do you have more or less hair in other areas? We will ask questions about pleasure. Can you maintain or obtain and maintain an erection for masturbation purposes? Watching porn? Is it only with a sexual partner you have problems? We will ask about morning erections. Do you wake up with an erection sometimes, which is still very normal well until adulthood? Are you able to ejaculate? And if not, were you able to prior to this becoming a problem, and how long has it been? We will also ask history about urination. Are you having problems going to the toilet? Are you going more or less frequently? And we'll ask general health history questions because of the 80% that are secondary to something else. Have you gained weight recently? Are you smoking? Tell me about exercise. Tell me about diet. From there, we then tend to investigate for the cause why with a blood test. So this may include a full blood count, thyroid function, liver, kidneys, cholesterol, sugars. Again, going back because, say it with me now, 80% are due to some other type of health problem. We will also look into a hormone profile, potentially. Of course, hormone causes of erectile dysfunction are a little bit more rare, at least in my experience. So it may be a secondary line of investigation we go down. But yes, just know that there's a lot of blood tests we can do. Typically, we don't image anything. We don't typically do prostate ultrasounds, scrotal ultrasounds, penile, anything really, because it's more hormonal. Unless we know for a fact there's been an injury to the penis or whatever. That being said, just because we don't image it doesn't mean we won't look at it and feel it and make sure that there's no lumps or bumps where there shouldn't be. Make sure that there's no swellings where there shouldn't be, especially within the scrotum. It's a thorough examination for sure, because it'll also include blood pressure, height, weight, etc. But it's important. So what can we do about erectile dysfunction? Obviously, if we find a cause for it, let's fix the cause. So if it's because your sugars are high, let's get them back down to normal. If it's because you're got really high cholesterol, really high blood pressure, let's bring those down. If it's because you lack in testosterone, let's start you on hormone replacement therapy or testosterone therapy. If everything comes back quote unquote normal, and you are one of the 20% who are more psychogenic, or we found a cause but it's not something easily fixable or it's more chronic, then there are medications we can use as well. So everyone knows Viagra. Viagra actually, this is one of my favorite trivia pieces. Viagra was actually used for blood pressure in the lungs, for pulmonary hypertension, and they just kind of found, oh, there was a wonderful side effect for 50% of the population. And so it wasn't actually that good at reducing the pressure in the lungs, so now it's used primarily for this. But Viagra is not the only medication for erectile dysfunction. There's about 3 or 4. Thinking brand names, there's Cialis, there's Viagra, there's Spedra, all of which work very similarly in dilating the blood vessels to the penis. More blood that goes in, the harder it is, therefore erection. Most of them act within a couple of hours. Spedra or Spedra, I think it's Spedra, in particular works quite quickly in terms of it's 15 to 30 minutes before sexual intercourse that you're recommended to take it. Prices vary. There's a whole lot of reasons why one might suit you better than another. Side effects of all of them actually include congestion and headache though, so they're not without risks. Other options are actually more surgical. You can get intercavernosal injections, that is injections into the penis. However, a GP wouldn't typically do this, at least none that I've ever met would. This would be under the guidance of a urologist. And there are also penis pumps, there's psychological therapies, especially if that's the cause. There's a lot of things we can do to help, is what I'm trying to say. So there you go, guys. One of my first videos on a essentially male-only topic, erectile dysfunction. If you've learnt anything, let me know. If you like this video, give me a thumbs up. Leave a comment down below telling me what you want to see from me next. And if you haven't already, please also consider subscribing. Until next time though, guys, do stay safe, stay healthy, and I will see you in a video very soon. Bye.